nursing student here at McMaster University, and today I'm going to be filming a video that explains catheterization. I'm going to begin by checking with my patient and asking them their name and confirming their date of birth so that it corresponds with their wristband, to making sure that I'm putting the catheter in the right person. Because if I'm not, that would be bad. The purpose of the catheter is to relieve pressure in the bladder due to buildup of urine, and also to drain the urine, whether that be for sampling or just to relieve the pressure like I mentioned before. I'm going to begin with hand hygiene, everyone's favorite. Making sure I get my hands nice and clean before beginning this sterile process. I'd also like to note that the bed is in a 10-degree elevation, so the height of the bed is at 10 degrees, and my patient is in supine position. I'm now going to begin by opening the sterile field just by touching the edges. I'd like to note that I'm not going to reach over so as not to contaminate the sterile field. I'm now going to pick up this tweezer, being careful not to touch the edge so that I remain sterile. I'm going to pick up the sheet at the edge, and I'm going to use my finger at the other edge to place this on the bed, making sure that the shiny side is down to help with absorption. Perfect. Now I'm going to pick up this other absorbent layer and put it over the patient. Again, only touching the edges. So we're just creating a dry area over the patient. I'm now going to remove all of the things from my little bucket over here. So I have my sterile gloves, I have my cup with cotton balls in it, I have my sterile lube, my syringe to inflate the balloon, and my catheter. I'm going to place these tweezers now on the side of the bucket because I won't be using them again. Before I put my sterile gloves on, I'm going to make sure I open the saline and add it to the cotton balls. This is because the saline is not sterile, so I don't want to contaminate my sterile gloves. I'm now going to place my sterile gloves on. I'm going to pick it up using the inside so as not to contaminate the outside. I'm going to make sure all the fingers are in the right place. I'm going to pinch and pull down. Same thing for the other side. I'm going to pick up using the outside because now my hand is sterile. And I'm going to pinch from the outside to put my gloves on. So now because this hand is sterile, I can touch the glove. Just being sure not to touch the inside and not to touch my hand. So now I'm going to begin the insertion of the catheter. First, I'd like to check to make sure the balloon inflates, and I'm going to put lube on the catheter. I'm going to move the catheter to the sterile field, just so I have more room to work with, bringing the lube and the syringe with me. Removing the lid. I'm going to push on the 10mm syringe, releasing all of the solution, and as you can see, the catheter inflates appropriately. I'm now going to deflate to make sure that works. And all processes are in order and working appropriately. Now that it's deflated properly, I'm going to note that the syringe is still on. Using the lube, I'm going to put some onto the absorbent sheet and run my catheter through the lube. This will help with more efficient insertion. Okay, before I insert the catheter, I'm going to make sure I clean my patient. Using the sterile tweezers inside the tray, note that these are different than the ones that I used earlier. I'm going to grab a cotton ball and clean my patient from the outside in. So from clean to dirty, so as not to contaminate the patient more than they need to be. Doing the other side now. Okay, and now finally time for the insertion of the catheter. I'm going to find the urethra and put the catheter in. In a normal hospital situation, once the catheter is far enough in, urine should drain, and so I note that I would have a cup at the edge of the catheter to collect any drainage. Now I'm going to inflate the syringe, inflate the balloon by pressing on the syringe. Because I cleaned with this hand, I'm making sure that I'm no longer using it in any of the sterile processes. So the catheter is inserted, the balloon is inflated, and I'm going to give it a little tug to make sure that it stays in, and that shows that the catheter is inserted properly. At the end of this process, I'm going to remove my gloves in a proper way, and I'm going to implement hand washing, hand hygiene in case my hands are visibly soiled after this process. Now I'm going to be adding on the fluid bag to the patient's catheter. I'm just going to get myself a new pair of gloves as we begin another process. You don't need sterile gloves for the insertion of the fluid bag. This is the fluid bag. I'm going to connect it to the end. And I'm going to make sure to hang it using the hooks off a rail that is not usually brought up or down, so as to not interfere or cause any abrasion's not the word that I want, but to cause any trauma to the patient's vaginal area. Now that the bag is in, I'm going to suddenly remove the catheter because the patient no longer needs it. So, using my gloves, I'm going to deflate the balloon. I'm going to insert. Once inserted, I'm going to make sure 10 milliliters of fluid drains. You don't have to push on the end, but you can pull it a little to help, and all the fluid should drain, and now the balloon should be deflated and make for an easy removal of the catheter. I can place the catheter back on this absorbent sheet, and the fluid bag has also been removed. It's important to transfer the urine into a measurable cup so that we can account for the patient's ins and out and put it correctly in their chart data. And all of the waste that we've encountered in this process will go into a biohazardous bag because it's been in contact with the patient. Thank you so much for watching my video. I hope that you understand a little bit more about catheterization now.